So for this procedure checkoff, we are going to be inserting a nasogastric tube as well as removal. First, you will check the physician's orders. You're going to verify the patient with the armband with the procedure card to make sure we have the accurate position. You're going to wash your hands as we have shown in previous videos. You will don on a new pair of gloves. You're going to assist the patient in a high Fowler's position as long as it's not contraindicated. You will need either a towel or a disposable pad. You will have tissue, ice chips, Emesis basin, and water as long as they are able to swallow. You're going to exclude one side of the nostril, making sure that they can breathe out of the other. Then you will do the same thing on the other side. After you do that, you will get your nasogastric tube out of the packing. And then you are going to measure from the tip of the nose, extend it to the tip of the earlobe, down to the xyloid process. Once you have confirmed what that number is, you will secure it with a piece of tape so that way you know how far to place the tube. Once you secure the tape, you will go 3 to 4 inches in with the tip into the lubricant. You're then going to insert into the nose. You're going to go downward and backward, and as long as the patient can and the tube can still move, you can have them tuck their chin. You will discontinue the procedure at any point if they become in distress, start coughing, inability to speak, hum, become cyanosis. Once you have inserted the tube to the placement, you will temporarily secure the tube. You will verify placement by aspirating gastric contents and then testing them on a pH strip, as well as doing a chest x-ray to show placement. After you have shown that it is properly placed, you will secure the NG tube with a piece of tape. You will attach the tube into suction, clamp it off according to whatever the physician's orders are. You will dispose of gloves. You will wash hands. You're going to document the type of tube used, the size of tube, which nostril that you use, description of the gastric contents, verification of placement, as well as how the patient responded. Now, when it comes to removing the nasogastric tube, we are going to verify the order, ID the patient, explain the procedure to the patient. We are going to perform hand hygiene how we have shown in previous videos. We are going to don on a new pair of gloves. You're going to disconnect the NG tube from any suction or feeds that they are in. You are going to place a towel across the patient's chest. You will remove the tape. You're going to instruct the patient to hold their breath while removing the tube. You're going to slowly and steadily remove the tube. Once the tube has been fully removed, you will dispose of it in the proper bin of disposal. You're going to provide nostril care to the patient. Then you will remove gloves, perform hand hygiene again. You're also going to document the removal of the nasogastric tube and the patient's response. Thank you.